We talk so much about physical health, eating right and exercising and all that.
Right.
But taking care of our minds, our mental health, sometimes that gets pushed to the side.
Yeah, for sure.
Well, today we're really going to dive deep into mental health.
Okay.
We'll be looking at what we know about it,
Yeah.
how education can change things,
Okay.
and why there's still so much stigma, especially for young people.
Absolutely. Such an important topic. And the sources you've pulled together for this deep dive really highlight that.
Right.
We've got this research article from the Journal of Mental Health and Clinical Psychology.
Yeah.
It looks specifically at how teaching college students about mental health can actually change the way they think and feel about it.
Interesting.
Then we have this piece from Pine Rest Newsroom.
Uh-huh.
It stresses just how widespread the need for mental health awareness is and how damaging that stigma can be.
Yeah, stigma is a big one.
Definitely.
And to round things out, we have an article from Brown University Health. That one focuses on Mental Health Awareness Month and ways we can all help raise awareness.
Sounds like a good mix.
Yeah, so today we're going to try to unpack all this for you.
All right.
We really want to understand where things stand with mental health awareness, how education can break down those stigmas, and what steps we can actually take to improve mental well-being.
Right. Practical steps.
Yeah, and we'll be keeping in mind the unique pressures that college students face.
Definitely a group that needs a lot of support.
So let's jump right in.
Let's do it.
The Pine Rest article starts off with some pretty eye-opening numbers
It does, yeah.
about how many people are actually dealing with mental illness every year.
The scale of it is really what's striking, I think.
Yeah.
They say that almost 20% of adults experience a mental illness every year.
Wow, 1 in 5.
It's a lot. And when you look at teenagers, that number jumps to almost half,
Really?
46%.
That's huge.
And even 13% of children are affected, too. So
Wow.
it's a significant portion of the population.
Yeah, those numbers are hard to grasp.
Yeah.
And yet, with so many people struggling, our research article points out that a lot of people aren't getting help.
That's right.
It says that globally, almost 2/3 of people with a mental illness don't get any treatment from a doctor.
Wow.
And even here in the U.S., with all the resources we have, a lot of adults who need help just aren't getting it.
It's really concerning.
Yeah, it is.
And when we think about college students specifically, it's even more worrying.
Right.
The research shows that a lot of them are facing mental health challenges,
Mhm.
but only about a third are actually getting any professional support.
Why do you think so many people are hesitant to get help?
Well, all three of our sources point to one major factor: stigma.
Yeah.
The Pine Rest article is really direct about it.
Uh-huh.
It straight up says that stigma is one of the main reasons why only half of the people dealing with mental illness get the treatment they need.
It's sad, really.
What's really troubling is how far-reaching the consequences of that stigma are.
Yeah. What are some of those consequences?
Well, Pine Rest lists a few
Yeah.
higher medical expenses. For one,
Right.
they also mention poorer performance at school and work,
Huh?
fewer job opportunities,
Yeah.
and, tragically, an increased risk of suicide.
That's really heavy.
It really highlights how serious this issue is.
Yeah, it's not just about feeling a little awkward or uncomfortable.
Right.
It can have a devastating impact on people's lives.
And our research article backs this up.
Mm-hmm.
It points out that both the lack of mental health education and the presence of stigma contribute to people not using the services that are out there.
Right.
There's even a finding that young people might actually discontinue treatment because of this perceived stigma.
That's heartbreaking.
It is. There are a lot of studies that have looked into this.
What have they found?
Well, for example, feeling embarrassed because of the stigma around mental health is a consistent barrier to seeking help.
Yeah, people don't want to be judged.
And Corrigan, who's a leading researcher in this area, has pointed out that this fear of being judged by society can lead to a lot of internal shame for people who are already struggling.
That makes sense.
It's a lot to carry.
Something that really stuck with me from the Pine Rest article
Yeah.
was that mental health conditions have a much higher rate of negative stigma attached to them
Right.
compared to physical illnesses, like heart disease or diabetes.
That's a great point. Why do you think that is?
Well, I don't know for sure,
Ah.
but it seems like there's a long history of misunderstanding when it comes to mental health.
Yeah, I think that's a big part of it.
For a long time, we didn't really understand the biological and neurological side of things.
Right.
So there was a lot of blame and misjudgment.
Unfortunately, yeah.
And the media hasn't always helped either.
Definitely not. They often perpetuate harmful stereotypes.
And I think we just haven't talked about mental health as openly
Yeah.
as we have about physical health.
That lack of open conversation definitely contributes to the problem.
It all creates this kind of vicious cycle, doesn't it?
In a way, yeah.
Like stigma prevents people from getting help,
Right.
which then silences the conversation even more.
Exactly.
And then that lack of understanding continues in the community.
And our research actually states that stigma can interfere with how mental health services are provided and used.
Wow, so it affects everything.
It really does. And as the research highlights, if people see seeking help as something shameful,
Yeah,
they're much less likely to do it,
makes sense.
which is why education about mental health is so crucial.
Okay, so let's talk about that.
Right.
Our research article dives into this, focusing specifically on college students.
Right.
And it emphasizes that these mental health issues really affect their daily lives
That's the
and how they perform academically.
Yeah, it's not just something that stays separate.
No, it impacts everything.
One of the key findings in the research is that a big barrier for college students seeking help is simply not knowing enough about mental health resources, what's available
the campus.
right there on campus.
So it's not just about overcoming stigma within themselves.
No,
It's also about knowing where to go to actually get support.
that's a big one.
And the article says that a lot of students don't even know that counseling services exist at their university.
It's like having a safety net, but not knowing it's there.
Right, like what's the point?
Exactly. It really shows how important it is to be proactive,
Yeah.
to get that information out there.
Okay, but what's encouraging
Yeah,
is that the research suggests education can be a really powerful tool
definitely.
to raise awareness, improve understanding, and reduce stigma.
I completely agree.
The study actually looked at the effects of students taking an abnormal psychology course,
Oh, interesting.
which is a course designed to teach them about mental illness.
Right.
And the findings showed some really positive changes.
Oh, like what?
Well, after taking the course, students were more likely to believe that mental health conditions are treatable
That's great.
and less likely to feel embarrassed about them.
Wow, that's a big shift in perspective.
It is. Just having accurate information can really challenge those deep-seated stigmas.
I think so too.
And the research found a direct connection between taking the course and the students' overall attitudes towards mental health.
It makes sense. The more you know,
Yeah.
the less likely you are to buy into harmful stereotypes.
There's also some interesting evidence about awareness campaigns on college campuses.
Oh, tell me about that.
The research shows that these campaigns have actually been successful in raising awareness about mental health
That's great.
and changing student attitudes in a positive way.
That's really encouraging.
It seems like actively educating people and fostering those open conversations can make a real difference.
I agree. Those kinds of efforts on campus are so important.
The research also mentions that mental health education can help normalize the idea of seeking help and actually motivate people to take action when they need support.
It's not just about knowing the facts.
Right.
It's about feeling empowered to actually use them.
Exactly.
The article also cites a study that found these awareness campaigns have the potential to really reduce stigma among college students
And
and encourage them to reach out for help.
that's what we want.
Absolutely.
And the research shows that mental health education can have a big impact.
Yeah.
It significantly increased knowledge about mental health
Right.
and had a moderate but still important effect on reducing stigma and improving attitudes overall.
So investing in mental health literacy really does pay off.
It does. Let's go back to that study that looked at the abnormal psychology course.
Okay.
What were some of the key takeaways from that?
Well, the main finding was that after the course, there was a really clear difference
Yin.
in how students understood and thought about mental health.
Uh-huh.
And there was a noticeable decrease in stigma, too.
We talked about that a bit. Right.
We did. They started to see mental health conditions as more treatable
Yeah.
and less embarrassing.
The study also found a link between a higher level of mental health awareness
Yes.
and a lower level of stigma after the course.
Right. So as their understanding grew, their negative views decreased.
It's almost like a direct correlation.
Yeah, I think it shows how powerful education can be.
And on the other hand, the study found that students who started with less awareness and more negative beliefs
Right.
tended to have more stigmatizing attitudes.
It really emphasizes how important it is to build that foundation of knowledge
Right, from the beginning.
and challenge those initial misconceptions.
Now, the study also looked at whether certain demographics played a role in these changes.
Oh, interesting.
Did any particular groups show bigger shifts after taking the course?
Yes, there were a few.
Wow.
Well, Asian and Hispanic students showed big improvements
Okay.
in their scores related to beliefs about mental illness.
Yeah.
Students who had a family history of mental health issues also showed significant changes.
Interesting. Anyone else?
Yes, psychology majors
Okay.
and female students as well.
So it seems like mental health education is beneficial for everyone, but it might be especially impactful for certain groups.
Absolutely, and that's really valuable information.
Yeah, it can help us tailor educational efforts to be more effective.
I agree.
Now, let's move on to the Brown University Health article.
Okay.
It focuses on Mental Health Awareness Month, which is in May.
Right.
Why is it important to have this dedicated month each year?
Well, it serves as a really important focal point.
Uh-huh.
It's a time to really educate the public about mental health,
Okay.
raise awareness about research and available treatments,
Yeah.
and actively work to reduce that persistent stigma.
It's about getting those issues out in the open.
Exactly, giving them the attention they deserve.
The article says it helps people recognize the impact of mental illness,
Uh-huh.
both on individuals and communities,
Right.
and to learn about the support services that exist.
And it encourages people to become advocates, even if they haven't personally experienced a mental health condition.
That's important.
It is.
Everyone can play a role.
And just talking openly about mental health, as the Brown University article stresses,
Yeah.
is so powerful.
In what way?
It can challenge those misconceptions
Uh-huh.
and reduce the stigma that keeps people from getting help.
It's about creating space for honest conversations.
Exactly. And for connection.
Mental Health Awareness Month also provides opportunities for larger scale action.
It does, yeah.
Things like fundraising and community outreach events.
Right. A lot of those are organized by national and local mental health organizations like Mental Health America or
Right.
MHA
Yeah.
and the National Alliance on Mental Illness or NAMI.
Great organizations.
They do incredible work.
So we've talked about the challenges and the role of education,
Right.
but what are some specific things we can do in our own lives
Okay, great question.
based on what we've learned from these sources?
Well, both Pine Rest and Brown University offer some practical advice.
Okay.
First and foremost, showing respect and acceptance towards people who are dealing with mental health challenges.
It sounds simple.
It is, but it's so important.
Yeah, just treating everyone with kindness and understanding.
Exactly.
What else can we do?
Another thing is to advocate for the rights and opportunities of those individuals,
In our communities.
wherever we have influence, whether it's at work, school, or in our social circles.
So speaking up against discrimination
Yes.
and pushing for inclusion.
That's a big part of it.
And Pine Rest emphasizes that learning more about mental health ourselves can make us better supports for others.
Definitely. The more we know, the more helpful we can be.
It all comes back to education, doesn't it?
It really does.
The Brown University article also talks about reaching out to people who might be struggling.
Just starting a conversation can make a difference.
Sometimes people just need to know that someone cares.
I agree.
It can be that first step towards getting help.
And we also need to educate ourselves about the reality of mental health issues and confront any judgments we might have. It's about changing both our actions and our perspectives. And finally, supporting those mental health organizations, volunteering, donating if we can, or just participating in their events.
All those things help.
They do.
Now, it's important to understand what mental illness actually is.
Right.
The Pine Rest article has a good definition.
What is it?
It says it's a physical illness of the brain
Okay.
that causes problems with thinking, behavior, energy levels, or emotions.
It affects how you function in daily life.
Exactly.
It's important to remember that it's a health condition.
Yeah, like any other.
The article points out that the causes can be really complex. Genetics, brain chemistry, trauma,
Right?
even other medical conditions can play a role.
It's complicated.
There are a lot of different mental health conditions, but the article highlights anxiety disorders and mood disorders,
Like,
depression, bipolar disorder,
those are some of the most common ones.
and recognizing them as legitimate health concerns is key to fighting stigma.
So to sum up, it seems like the main takeaway here is that mental health awareness and education are absolutely crucial,
I couldn't agree more.
especially for young adults.
They're at such a critical stage in their lives.
And the research shows that education can really change people's beliefs about mental health,
And reduce that harmful stigma.
which is what we want.
Absolutely. It's all about creating a more supportive and understanding environment.
Right, and we need to keep working to make sure that mental health education and resources are available to everyone.
I agree, both on college campuses and in the wider community.
This is an ongoing effort, not something we can just fix overnight.
It requires constant attention and action.
Here's something for you to think about.
Okay.
Given how important education is in shaping attitudes towards mental health, What are some new and maybe even unconventional ways we can integrate mental health awareness into different educational settings,
Interesting question.
from elementary schools to universities,
Right. Everywhere.
and also within our communities?
How can we make it a part of the fabric of society? That's a great question to consider.
How can we be creative in fostering a more supportive and understanding environment for everyone?
It's something we should all be thinking about.
And what's your role in creating a culture of openness around mental health?
It's a conversation we all need to be a part of.
This is something that affects us all.
It really does.
So let's keep talking about it.
I agree.